Ear infections are very common among children, and it may be really frustrating for parents to hear that their child has ear infections over and over again. One of the things I like to explain to families is, well, why do children get ear infections in the first place? When children are younger, the middle ear is still developing. The middle ear is actually a space filled with air just like this room. Now this space fills itself with air or breathes through a little ventilation system called the eustachian tube. In infants, toddlers, and preschoolers, the middle ear is still learning how to breathe and drain, so it's easier for fluid to build up and cause recurrent ear infections. As children get older, the middle ear matures and breathes more reliably to prevent fluid from building up. The popular question then is, how many ear infections are too many? It is often commonly thrown out there that 3 ear infections over 6 months or 4 in a year is the number of infections and time frame that we think about whether a child may benefit from having ear tubes placed. The decision about whether it's helpful to place ear tubes in a child is a little bit more complicated than that, and really has to do with our ability to predict the future. Just like learning to walk or talk, the ear learns how to breathe and ventilate more reliably on its own. Now, when that happens may be very different from child to child, but we can look at a number of clinical factors that help us to predict this. How old are they? Typically between 6 months and 5 years old is when children are most likely to be susceptible to this problem. Whether they are in daycare or another group childcare setting that might expose them to a lot of viruses that cause upper respiratory infections, or whether they're exposed to secondhand smoke. On evaluation, we'll assess whether there is currently fluid built up in the middle ear space, which may help to predict a future problem. And lastly, we will ask you in their medical history if there's any issues with developmental delays or speech issues or other growth and development problems that may be further impacted by middle ear fluid. We try to predict what's the weather going to look like for the middle ear. Are we going to have continued stormy times and persistent problems over the next 12 months or so? If so, then ear tubes may be very helpful. However, it is possible that at some point we may be at the end of that storm period, or it seems to suggest that actually the child may be closer to outgrowing this problem, that ear tubes may not be helpful, and a watchful wait may be more beneficial to the child. It's always best to avoid surgery that may not be beneficial.